there's a rapidly increasing number of research projects targeting the question of what are the health impacts of climate change.
What we are trying to do is develop early warning system that gives warning good 1 to 3 months ahead of time to help communities adapt to the threats of climate change.
I'm one of the co-leads for the CHAMNA project, which is looking at the impacts of heat on maternal and newborn health in Africa.
We've set up a program called PREP. It's Prevention, Resilience, Efficiency, and Protection.
Within the exhaustion project, we're looking at the synergistic effects of air pollution and extreme temperatures across Europe.
If you have so many workers working in the heat, the more likely is that the kidney disease in these regions will rise.
The purpose of ENBEL is to bring together the researchers to form a consortium of people who can work together to enhance the impact of the research going on in the individual projects. First and foremost, I think our project has contributed to making links between climate scientists and health researchers.
We as scientists, actually often we are telling that there is a problem. But politicians and also policymakers, they have a different view on things. It's important to understand what are their kind of views on the things and what are the expectations from the scientists.
It's really a two-way dialogue, so we're talking to the stakeholders about what evidence they need, and we need to translate that back to the researchers so they produce research that's actionable.
ENBEL is one of a kind in that it has such a wide variety of experts and stakeholders, and it's looking at state-of-the-art results from so many different projects. It's collating the results together, but it's also assessing where to go next.
There are two very important sides in ENBEL. One of those is synthesizing the data. Other side has been networking, also focusing on the areas where we can see really big impacts, as in Africa.
International work within the ENBEL is very important. Knowledge gained in Nicaragua or Kenya can help Spain, can help Italy.
The key contribution of ENBEL is the ongoing implementation of measures, in particular indoor-outdoor air pollution and venereal diseases that are now being more focused in African countries. The creation of the CHANCE network, it's the best example of the increased interest from the local authorities.
The objectives of the network revolve around knowledge exchange, facilitating learning opportunities, and providing support for policymakers to create policies that work.
Having ENBEL, having the researchers produce quality data really assists international organizations like the ILO to ensure that we're really using evidence-based processes, that we have that cross-pollination between researchers and policymakers. Never before has the science policy interface been so critical to creating global policies on the environment and also on the protection of workers.
Also, the contribution for the European Commission Strategic Research and Innovation Action, that we will launch the roadmap soon. And since ENBEL is covering key areas on climate change impact in health, definitely it will be taken into account, not only in the next framework program, but in the European strategy for climate change.